Uh, my talk today is comparison curve Kelman and the straight and transversal units ultrasound phacoemulsification. What is the ellipse technology and how does it work? What is a transfer? The traditional phaco is the movement of the phaco tape is longitudinal, and while the previous talk the axial and the transversal is combined in one screen between the traditional and the transversal. In the axial IB, this is the combination between transversal, but it's not simultaneously work. In a modern phaco, it must be save less energy, less heat, stable interchamber, and less turbulence. Efficient if reduced surgical time, less turbulence, and fluid consumption, and stable interchamber. Also prevent surgical complication, burns, endothelial malfunction, PCR, CMA, and many more. And in US technology, EMO is also a white star, and white star is the previous speaker tells you about the pulse and burst, but this in white star there is where the phaco on can be in one duty cycle. There's whatever you want 100%. It means that 60% or whatever in one duty cycle, it means that energy on 60% and 40% off. And also in the signature, it is a case fluidic system to control the stability of the anterior chamber. And the signature ellipse Kelman 30% and straight set study is the purpose of the study is to compare the efficacy and safety between the Kelman 30 degrees and the straight set in phacoemulsion using the US ellipse technology. It is non-randomized prospective study. The study is June to December. Methods. The pre-op selection, senile cataract, nuclear density 2/3, interferometry, and surgical technique phaco chop using Kelman and the C group and straight and S group. Surgical parameters, observe, US use ultrasound time, EPT, US average, and the ellipse, then follow up, and D1, T7. This is my setting. This is 25% on transversal and 70% on phaco. This on your left, I use Kelman tip, and on your right, using the straight tip. Chopping. I use the method of technique of vertical chop. Segment by segment. Okay. And what is the result? There is 103 phaco chop with the Kelman 30 degrees and straight tapes. On the Kelman 30 degrees, total 54 eyes, and on the straight tape 49 eyes. Divided into two groups, density 2 and density 3, and the efficiency in US time in density 2, 45 eyes, there is no significant difference between US EPT and US average and ellipse and in straight and also in Kelman tape. But in density 3, there is significant difference. US phaco time in Kelman tape more efficient, and then also on the ellipse there is a Kelman tape more efficient. This is the study on day 2. On the day 3, there is one eyes is under line. And how about the safety? The surgical complication in corneal striae in density 3 and density 2, there is no Kelman, there is no corneal striae on the density 3, and there is 2% and 1% corneal striae in density 3. So in summary, non-randomized prospective study on 103 phaco chops, density 2 and density 3, 50 eyes with Kelman tape and 40 with straight tape. They were significantly shorter in US time and US ellipse with the Kelman tape, and there is no PCR complication. There was no corneal striae in density 2 and 3% in nuclear density 3, and there was no incision burns, and overall result best corrective visual acuity reached expected at the T7. In conclusion, the Kelman tape more efficient than straight tape and harder cataract in ellipse ultrasound technology. Both Kelman tape and straight tapes were safe and efficient. Thank you very much for the